I want to show you the grifter playbook. So a follower sent this video to me because she said it reeked of blatant disinformation. And guess what? She was right. Watch this clip.
3 things doctors don't tell you before IVF. Number 1, that they don't actually care about fixing your infertility. Most women go to their doctors expecting them to figure out why they're not getting pregnant. Instead, they find out that their doctors could care less.
Doctors could care less? I think what she means to say is that we couldn't care less. That's what she's trying to say. The vast majority of us do really care. And we entered this field because we actually wanted to help people. Becoming a doctor is a huge investment, and this involves investing decades of your life. Also, that we can have the privilege and the credentials and the opportunity to evaluate and treat medical problems in a legitimate way. How long do you think that this woman studied or trained?
Simply push them into IVF.
Push them into IVF? Well, here's the thing. What we recommend depends on what the diagnosis is and what the patient's goals are. This person's post lacks nuance, right? When a patient comes in, we test them, and depending on what's found, we offer them a wide range of treatment options. And yeah, they might end up needing IVF because they have blocked tubes, they have a low sperm count, or maybe we want to test the embryos because of egg quality issues. But I'm sure she's going to tell us how her fertility activation method, trademark, is superior to the most high-tech, efficient, effective treatment options in the field of fertility medicine that exist today.
Number 2, when fertility treatments don't work, your fertility might be worse off than when you started.
This is a false claim. There's absolutely no truth to the idea that fertility treatments, whether you're talking medicated IUI or IVF, deplete your egg supply, impact your egg quality, or have any negative impact on your fertility or the ability to try on your own or with treatment.
On average, it takes 3 IVF cycles to get pregnant, and that's if it works. Sadly, after spending tens of thousands of dollars, most women still don't get pregnant, especially over the age of 35.
Actually, the average number of IVF cycles for patients to get pregnant is not 3. This is a made-up statistic. It's highly variable from person to person, but I have many patients who are able to make 1 or more normal embryos from 1 round of IVF stimulation, and with each normal embryo having about a 60 to 70% chance of live birth per transfer, they may only need 1 round. It really depends on the person, their egg quality, their diagnostic testing, their family building goals. See, again, a complete lack of nuance. And how much money are you charging for your program? According to the online reviews, it's thousands of dollars, anywhere from $1,500 to $2,300. And I'm not really sure from your vague description what it actually offers.
When fertility treatments don't work, they'll simply blame it on your age and your eggs. At this point, they'll brush you off or recommend that you use an egg donor.
No, fertility treatment can either work or it can fail due to multiple factors. And by the way, up to half of cases of infertility involve a male factor. So this is your bias, not ours. The decision to move on to using donor egg is a highly charged, delicate, and sensitive matter. And it's one that we fertility doctors do not take lightly. We will try anything and everything to get you there with your eggs if it's possible. Please don't shame women who rely on using donor egg IVF to build their family by insinuating that they just didn't try hard enough and they didn't do your program. And that's why.
P.S. They also don't tell you that egg quality can be improved.
How are you going to improve egg quality, pray tell? Look, you're not offering a unique service or any novel information. So stop with the smoke and mirrors. There are many people, including doctors and clinics, who will promote the benefits of healthy lifestyle changes, trying certain antioxidant supplements like CoQ10, controlling chronic medical conditions, maintaining a healthy BMI. And yes, we will say go for alternative or complementary treatments if you want to, like acupuncture, because there really is little harm or downside as long as they're not being predatory. Is there strong data to support that acupuncture can replace modern medicine? Treatments like medicated IUI and IVF to help people overcome infertility? No, that's a reach. And if you go to someone and they're saying things like this is a major red flag and should not be trusted.
If you're tired of feeling like your fertility is out of control, take the next step towards claiming your fertility by watching the free training, the 5-Step Fertility Reset.
This is a scam artist playbook. Put up an emotionally charged post, makes you question modern conventional medicine and distrust your doctor and your clinic. And then when the patient is vulnerable, lay on the scare tactics. This is designed to deter you from even seeing a fertility doctor in the first place. And then offer an alternative that seems too good to be true. Psst, because it is. Fake testimonials, fake success rates with no actual receipts. And then, of course, end the video with a sales pitch, luring the person in with a free intro video. I'm sorry, this is garbage, and it's targeting a vulnerable population. And guess what? This account preemptively blocked me. Note to all the grifters out there, if you find that before you post something or create your account, you need to go out of your way to block all the doctors and reputable sources for fear that they might fact check you. Take a moment, take a hard look at yourself and ask yourself, how do you sleep at night? Because clearly you know you're doing something nefarious.